All right, welcome to the panel. I hope everyone's fed, you had some sunlight, you're going to be ready for an exciting hour with our great panelists today. So we are very lucky today. We have Rob Smuts. He is the Deputy Director in San Francisco of the Department of Emergency Management that oversees 911. We have Marie Matthew, who is the Interim Director of the Community Safety Department in Cambridge, Massachusetts. And we have Ganesha Martin, who has a dual role now. She's connected with Mark 43 as the VP of Public Affairs and something else, Public Policy, I think, and recently appointed to a civilian position in the Minneapolis Department looking at constitutional policing. So it's great to have all of you here today. So 2 years ago, I remember many of us were sitting together in DC and we were listening to folks from Denver, Atlanta, Albuquerque, and Chicago, and we had a panel about 911 then, and a key thing that we were talking about is how do you figure out which calls are ripe for alternative response, which ones still need police, and how can we best help the people who answer those calls figure out that decision point, which is not easy. I think some of the things that I learned from that panel was that this is about constant learning and adaptation and adjusting, and that people make mistakes and we have to move forward from that. And so whether it's constantly going over your call for service data over and over again to figure out like what's the next category of calls that maybe could go to an alternative responder, or how do we keep building the trust between clinicians and folks inside 911? It's not just from one ride along when your program starts, but constantly having space for these interactions with one another is really important. And how do we get the community to be more comfortable with actually calling 911 and feeling like they might get an alternative response if that's what they think they want? So thinking through what public education looks like and how do we help the community understand even what to say on the phone to try and get that response that they really want as a result. So in the spirit sort of reflection and learning, I wanted to have today's panel be a bit of a check-in 2 years later to see what we've learned and kind of where we're going as a field, especially from this 911 dispatch perspective. So I wanted to start with Rob, mostly because Rob's program in San Francisco has been around for a pretty long time at this point in alternative response years. So San Francisco has a number of street crisis teams, and you've been involved from the very beginning with getting those up and running. And as someone who oversees the 911 side of things, I kind of want to hear some successes that you've experienced in this space. So what do you feel like has gone really well in the city of San Francisco integrating street crisis into 911?
All right, well, good afternoon. Thank you. I'd say, the biggest success is that we've continued to go forward. We launched a street crisis response team in November 2020, and we've continued to evolve what that does. We've also launched the street crisis response team focuses mainly on behavioral health issues, mid-acuity. We've also launched another team called HEART that responds to more low acuity calls, and so we've continued to launch teams and continued to expand what those teams focus on. And I guess as you add a call type, as you add another chunk that you're diverting from police response to alternative response, it gets a little easier, but not all that much easier. It's still a lot of work to figure out how to accomplish that and how to make everything move. But we've kept at it and keep going. And so I think that counts as a success.
Okay. Do you have any tips maybe or best practices that you all have done in San Francisco to do that really hard work of actually expanding or moving into new call categories?
A lot of collaboration. So the street crisis response team has a paramedic on it, so it's a medical response, and so falls under all sorts of EMS regulations, and so that gets pretty complicated moving calls over there. So that's just been a lot of work with our regulatory agency, with the fire department, which houses street crisis response team, with 911, and then with the police department where the calls are coming from. We particularly had early on as SCRT was ramping up and couldn't take all of the calls. You couldn't, flip a switch and go from police to SCRT. We had to have a pretty complicated sort of overlap as we were having police continue to backstop calls that SCRT didn't have capacity for yet. And so just there was planning, and there was also sort of feeling it out as it went along. And obviously, the more you can lean towards planning and learning from people who've done it before, and the better. We'd obviously do a number of things differently if we had the knowledge we have now back then. And it's been a challenge for the dispatchers. I mean, we keep throwing new things at them. One thing that I think is common in 911 is we're understaffed, and the ability to really dedicate as much attention to training as we should is oftentimes not there. And so we've had more success when we really have said, you know what, we know we're not answering our service standard for 911 calls, but we have to dedicate enough time to do this training right and to give them the resources to do it. We can't be messing it up and doing it 150 different ways because we have 150 different call takers. And so those are a couple points that I would really try to stress.
Okay. That's great, and I want to follow up on workforce in a little bit, but first I want to hear from Marie. If you can talk to us a little bit, since your program's newer, I think compared to SCRT, how is the integration going between clinicians, clinical response, and the 911 system in Cambridge, Massachusetts?
It's interesting. It's certainly been a journey. I would say, so in the very beginning, we really worked closely with our director of emergency communications to figure out, first of all, what call codes our department would be able to respond to. And in having those conversations, our medical director weighed in and essentially kind of changed the trajectory of who we hired on the team. Our medical director was very adamant that there should be licensed clinicians on every single call. And so our teams go out in usually teams of one clinician and 2 or 3 responders. And so, or 2 responders, 1 or 2 responders. And so our teams are being dispatched directly from 911. And so because of the way that we're dispatched, we essentially have the opportunity to just kind of, listen to the radios. We don't yet have access to CAD, and so that also has made things very interesting for us in terms of figuring out what's going on in that world because we don't live in it. And so all we have is the police radio that we listen to, and we have found ways to kind of take advantage of that. And so for us, we have the calls that we are dispatched to, and sometimes if we hear a call on the radio that we're like, hey, I think that should have been ours, we'll call and say, hey guys, I think that was ours. And we're annoying, right? Like, we are absolutely annoying, but we're very motivated to get out there and to get out on as many calls as we're eligible for. And so as a result, sometimes the answer is like, no, we didn't agree that this should go to y'all, even though it sounded like a care call. We sent it to police because we were concerned that even though it's an unwanted person, which is a call code that we are approved to go out on, we don't know if the person who is locked inside of the Dunkin' Donuts bathroom has a weapon behind that door. And so the safety concern for our dispatchers was really front of mind for them. And so essentially what we started doing is saying, like, all right, even if we're not dispatched, maybe we just start showing up. And so we would continue to listen to the radios. And so if we're not calling to say like, hey, could that have been ours or should that be ours? And they are like, oh, you're right, we'll cancel police and we'll send care. Or if they're like, no, we're not gonna send you, we may still show up anyway, knowing that police will show up on scene. And so if we hear that a call could utilize our support, then we just show up. And so I think getting people in the habit of just seeing our faces and us just being there, whether or not we are called on to support a community member is of no consequence, but I think that just the mere fact that we continue to show up, and then we are essentially just trying to teach dispatchers how to utilize us, because sometimes it's not very intuitive for dispatchers who have only had these 3 boxes that they could, check to send as a response. And so here we are trying to infiltrate into this pre-existing system, and so we have to be a little bit crafty. We have to be a little bit aggressive, but sometimes try to seem like we're not being aggressive about it. And so that's kind of how we've worked around helping dispatchers understand the breadth and depth of the work and the support that we can provide. And so I think as a result of us just kind of showing up in spaces that we aren't even naturally being called to, police officers are now, when they show up on a scene and they're like, yeah, we don't want to deal with this, let's go ahead and call the care team. And so that's one of the call codes that we are approved for, which is request for care. And so police can request us directly, and we show up on scene, and they hand the scene over to us, and they can move on to their next call.
And are those conversations between care and 911 happening in real time, or are these like after incident sort of discussions about, we heard these calls, we would like to go, or as soon as you hear it in the radio, someone's calling into the dispatch center saying, we want to go?
Yeah, early on, I would say we are, so for context, we're hitting our 1-year anniversary of going out on 911 calls on July 17th, so we're really excited about that. Huge milestone. And so in the beginning, we were only responding 3 days a week, and then we moved up to 4 days a week, and then 5 days a week. And so initially, we were meeting every single day with emergency communications, with PD, to discuss every single call that we were going out on. And so having those conversations very early on to ensure that folks were able to ask their questions and to process after the fact how calls were going, that's one way that we've had those conversations during those meetings. And then other times we would have just impromptu meetings in the event that a call that we went out on, things didn't go as desired, and there were questions that would come up. And so we would just put together a meeting on the calendars of everyone, and everyone would just kind of show up and talk through it from each of their perspectives, like the dispatcher, the people who were on scene from our team, and then PD as well. And so having those regular conversations and check-ins, I think, has been really instrumental in us being able to now not necessarily having to have weekly or daily meetings, but we are still checking in quite regularly with each other. And then, so when they do hear us calling on the radio, it's not like, oh gosh, who's calling? It's, oh, it's Marie, it's Kelly, right? You know who's calling and why we're calling. And so they know, and they're aware of our internal practices. And I think that has really helped to bridge the gap, because we're like, no, we're gonna call. If we hear something that we think we could be useful for, we'll call. And if it goes to us, great. If it doesn't, that's a point of conversation that we'll bring to our next meeting to say, like, why didn't that call come to us? And then what's really great is, like, the leadership in our emergency communication department does a lot of training with the team. So if they go back and they listen to a call that we've identified as a call that probably should have gone to us but didn't go to us, then they'll work with that dispatcher on an individual basis to say, like, hey, that was a call that care could have gone out on, and so, here's how you can look at it next time if you get a similar call. And then also working with the whole team of dispatchers around, making sure that they're very much aware of our utilization and how we can be useful on scene. And then we're also kind of working with new dispatchers as they are being onboarded, not only through ride-alongs, but also through through our department doing in-person trainings with the new dispatchers. So like we have dispatchers like as they're coming on and we hear them on the radio and they're like, hey, Kara, did a ride along with y'all. And so like just building those relationships, I think, from the moment a person starts in a department is really great. But then the people who've been there before, I think a lot of that training ends up happening either on scene, at the moment of the call, or they're having those conversations in trainings.
That's great. So I want to shift gears a little bit to think more about the tools that call takers are being given and the forms of guidance they receive from their organizations to help them make these really hard decisions. I think sometimes it seems easy when we talk about it occasionally. It's like, well, you just don't send the alternative responder if there's violence or if there's a weapon. And then what I've learned from call takers in Denver, call takers in San Francisco, like violence is actually really hard to define. Nobody can really give you a straight answer about what it means. And it's entirely subjective. And San Francisco call takers, they talked about, is yelling at the sky violence? Is a stick violence? Is that a weapon, right? There are all of these scenarios that all of a sudden make it complicated in the moment to make these hard choices. I think the guidance that often is given within these organizations is sort of rigid in structure, like, is there this? Yes, no. If no, send that. If yes, send this, right? Very rigid decision trees that don't always work when they meet sort of the real ambiguity and uncertainty that come up in street crisis calls. And so I want to hear from Ganesha a bit to think about what the role of technology might be or could be to help call takers make these hard choices.
So I'm going to be a bad panelist. I'm going to answer the first question that was here, and then I'm going to combine it with the second one, just because a couple of things were coming to my mind as we were talking. One, if we're reflecting back on last year, we were, I think, at 100. Now we are 300 strong. And so sitting here and looking out here, I think that in this time is a testament to the work. And so I think also we need to reflect that where we were from the first convening and where we are now, politically, it's like a family reunion. I'm seeing all my people out here. We've got to talk about that. We've got to contextualize this work in that there were people who were running to give us money. We were trying to figure out who's you want to fund my program? I'll take some money from you and you and you. And now, literally, the programming, the idea behind the programming, equity and helping those in need, and just sometimes even the titles of our programs are being attacked, right? And so, and by the way, so I did take a new job with the Minneapolis Police Department as the first civilian chief over constitutional policing. So if I say anything that's bad as a city employee, just blame it. I'll say I was actually here for Mark 43, and I was speaking on their behalf, my former role. But I think that is important. And I often talk about this when we're talking about focused deterrence or CVI work, violence prevention, or alternative response. 2 years ago, police recruitment was down. It was literally in the rooms with chiefs that I was in being called a crisis. So recruitment was down, and crime was up. And unfortunately, both for those who fund us from the government, from the community pressure that is created, it comes from those bad headlines sometimes. And so we're in a place, in a space, we're telling our narrative and telling about our work with data. I'm coming to the second question now. With data and with technology is ever more important. But as you all know, the data is what the council wants. The data is what funders want. The data is very, very important. The data lets us know if we're doing our job for the people that we said that we're trying to serve in the first place. But then the data also helps us tell the story of the people that we're trying to serve. And so one of the things that happened with Mark 43 is when I heard that Mariela was being funded by the mayor to the tune of, I think, $10 or $11 million, I said to Mark 43, that city is serious. And if that city is serious, I know that they're going to need a technology solution. So Mark 43 is a records management company, cloud native, that builds for police. They've never built in fire, in EMS, right? And so I said, this is when I first started working there, and I thought, you just tell some smart engineers, go build this. And then tomorrow they're like, you like it? Apparently it takes people and millions of dollars to build stuff. But anyway, I was like, if you're gonna do it, you need to do it. And so they listened to me, and they started building a tenant for ACS, and I got them to do it for free too. And so they were building it, but they were building it on the same technology they were building for police. And it was good because at that time, and y'all know this is not always the case, there was a great relationship between police and a great relationship between Mariella and ACS, Albuquerque Community Safety, which does not happen a lot, right? Because everybody's very, this is my data, and we don't trust police with our data, and police don't trust you all with the data. And so it was like a match made in heaven. So anyway, I got them, as they started to build it, they noticed that the police data was incident driven, whereas the data that you all need is people driven. And so they actually decided that they could no longer build it in that same tenant. They had to build a separate tenant. And so we ended up doing that for ACS, and then Amy and CARES, I know y'all are in here, decided to come along for the ride as well. And so the one thing that I want to uplift to this room, I think is super important, and I hope we are able to continue this conversation after this. The other thing I learned about working for a private company, and mostly vendors don't like me because I'm really tough on them, so it was funny that I was working for a vendor, but they have this thing called a TAM. I hate it. It's a total addressable market. I'm like, I know one person that needs it. But when they have to go to their board to get money to build these things, they want to know what's the total addressable market. Do y'all know how y'all got in this room? Word of mouth. Mariella didn't even put it out there on LinkedIn. So how hard is it for them to know the TAM when we're not out there like that? Number one. Number two, when you're building for police, and a lot of them don't even like it, but you have a standard, NIBRS. So that vendor is like, because what's the baseline? Because me and Heidi, my brain right here, we would sit and say, okay, what's the baseline? Let's talk to Albuquerque. Let's talk to Seattle. What's the very baseline stuff that you all need to tell your story and to help and serve your consumers? All of y'all need different stuff, right? Right? And so, and also you know that 911 data is a mess. It starts out one way and then it goes another, and it doesn't get changed in the middle. And so one of the things that I think hopefully will come out of this convening of everybody here who is on the ground and knows what's needed is for us to start, and maybe there's already some people doing it, I don't know, but starting to talk about those standards. Let's make the vendors actually be responsive to what we say we need, but we need to do that with the collective voice. The last thing that I'll say too is that the vendors don't actually know what's going on, because I've worked with a lot of departments that are creating alternative response programs. And they're over there looking at case management, which is important. But case management is not CAD and is not RMS. It is not the same. And the way that it integrates, whether it integrates with your CAD, okay, with your own CAD or the police CAD or the fire CAD, like these are conversations that because we get really focused on this work over here, and police are like this and fire's like this. And so I say all this to say that there's a whole collective ecosystem that I think we need to have a collective voice around, so that we're making sure that we're centering all the people, 911, you know, the responders, the vendors, the technology, so that something can be built that can serve this whole ecosystem.
I wanted to follow up quickly. So the CAD software typically has certain fields in it, maybe address, incident code a call taker might select, a notes field. Some of you probably already all know this. Mm-hmm. But I'm wondering, is Mark 43 sort of venturing in the, like, how do we form or design questions to help guide call takers as they process calls that might be eligible for alternative response, or is that not something that the CAD space does as much of?
Yeah, no, absolutely. But if you go to CalNEA or you go to any of these conferences, like when I was trying to help Oklahoma City, where they were creating their alternative response, and they went to Houston to look at what Houston was doing, and then we went to Tulsa, I think. We went around. So some people use scripts, some people don't. You know, one of the things that happens a lot with technology is when people are on paper, they really just want their technology to do what the paper does. They don't really necessarily want to improve on that. So I would say that one of the things that I like about Mark 43, and at least when I was there, one of the things that I tried to do, and my tagline was, how do you leverage technology to be responsive to the needs of the community and the first responders? Not the other way around. What's cool with technology? No. Well, how are you using your coolness and your tools to actually, you know? And so Mark 43 does a lot with talking to the people on the ground, sitting in PSAPs, doing ride-alongs, that sort of thing, to try and do that very thing you're mentioning. The last thing that I'll say, and it's going to sound like I really know what I'm talking about, but I don't. When I say cloud native, doesn't that sound great? Yeah, but the little bit that I do know about being a cloud native CAD and RMS is that if we build something for Oklahoma City, Seattle can use it. Anybody on the tenant, you can turn it on, you can turn it off. You don't have to say, you know, can you build that very specific thing or whatever. It's very configurable. And so in addition to trying to make sure that we are helping take crowdsourcing with the information that we know to build out better scripts, you can also use other people's best practices through the technology, but then also it's configurable enough for you to figure out, you know, kind of what it is that you need. And I don't know, I think we're going to get to this, but they're also, you know, toying around with some AI to help in that regard as well. Yeah.
So I want to shift to Rob a little bit to push on this question around protocol, scripts, vendors. So I know San Francisco 911, I think, uses the ProQA system to figure out whether or not a call should go to the SCRT team or a medic. How is that system going for your call takers?
Yeah, so we use Priority Dispatch for EMD, EFD. We don't use it for police. We're a unified PSAP. We do all of those things. And as anybody who knows Priority Dispatch, it's not a flexible tool. That they have international standards, and we convinced them to do a test protocol for the specific area we needed to do behavioral health calls, and they changed their 25 card as a result of that. But it's a challenge when you have a sort of rigid, and for good reason, for most medical calls, system like that, and you're trying to try new things and try to innovate. But we had to figure out how to make that work because it was the regulations around paramedic dispatch and so forth. And so, you know, that was a challenge. I'd say as we build it out and do this stuff, I think there's some role for that, and then there's some role that it really is a challenge to try to get too scripted. And you know, I think back on the discussion earlier about like what is violence or what is a weapon, and like for SCRT, one of the big things we tried to do was really push on what is a weapon and what stays with PD because it's a weapon versus what it can go to SCRT, and not say, well, they're in the bathroom, they might have a weapon. No, that SCRT can have that, or even they have a knife, but they were using it to cut food. You know that. Yes, they have a knife, but they're not brandishing it as a weapon. We can do that. But one of the things that gives me a lot of concern as the director is right now I have 168, I think, different call takers, including trainees. And figuring out how to have a common standard among all those different people when they're taking a call and they're asking these questions that are very hard to draw a bright line around is a challenge. And so I don't know the answer to that about like whether you could script that in a way that could be reliable. If you could, that would be wonderful. My intuition tells me that there are things like that you can't. You just have to train. That question in particular scared me a lot as we were rolling this out, and it has turned out to be okay. We haven't had any. I'm looking at my partners from SFFD here. I don't think we've had any real scary situations. There has been a lot of back and forth between us and the responders about what is okay. Can we talk to that dispatcher? Can we tweak this a little bit? But yeah, that's something we have to figure out, and I don't know if we've landed on an answer.
And Marie, in Cambridge, do call takers use ProQA or a script, or do you know what kind of tool that they use to make decisions?
No, in Cambridge, they do not use ProQA. And I think this is partly why we have taken the approach that we've taken, because things are not as scripted. We've kind of played around with the idea of having decision trees and things like that. But I think the moment that you kind of put people in a box, it leaves out the option of creativity, which is what I think alternative response really is, right? And so sometimes if you're too rigid in terms of what calls can go to us, it takes away the dispatcher's ability to be imaginative around, well, I wouldn't typically route this to, the care team, but maybe they could actually be useful on this kind of a call. And so I love the fact that we aren't boxing dispatchers in, and we're allowing them to make those choices. And then on our end, we help them get there too, right? So if we're showing up and we're calling and we're forming and building those relationships with the dispatchers, I think the easier it is for people to make those connections. Like, oh, I remember when I was on my ride along, they went on a call that was about this, even though they weren't originally dispatched. And so now that they're, call takers and they're out of their training, they're the ones who are putting us in the game. And so I think there's a lot of relationship building that is part of the long game that we all end up having to play in order to make it a natural response for the dispatchers to think about putting care in the game as opposed to dispatching PD or EMS or fire.
Yeah, I love how you talked about being imaginative and sort of that improvisational skill. And it's really hard to find that sweet spot between providing guidance, making sure people don't abuse their discretion, and then also still centering tacit knowledge that workers have because they actually do this job every day. And finding that sweet spot is sort of like the $1 million question, I feel like, that people want to know, and I don't have a great answer for either. But I wonder, can AI help us? Since it seems to be taking over the world, what does Ganesha think?
Well, I know ChatGPT helps me a lot. It makes me sound very smart. I don't know, but it's like one of those things where you want to use it and you want it to be helpful, but also it can be very overwhelming, right? And so, and the other thing too, about technology and vendors, it's also kind of like this race to the top. And so I know in particular in police departments, I don't think, because we don't gather like this in conferences very much or anything like that, so I don't know how much it happens with folks in the audience, but it's like, I can do this, I can do that, right? So it's right now, you can do report writing, you can do all sorts of things. And so really, and I think NYU Policing Project is trying to help people kind of muddle through this, but like, what is the right use for AI? So one of the things that Mark 43 has done is actually bring in our customers and say, this is what we're thinking about. What do you think? What do you want? What do you need? What are the protections that would be helpful to you? What is it, me, I'm always trying to center the voice of the user and in the community. Like, talk to your community, talk to the people who are going to be using this and ask them. But we're dealing with very sensitive data. We're dealing with HIPAA protected and CJIS protected, and so being very careful. But one of the things that Mark 43 is doing, in addition to talking to its customers, is helping to divert calls maybe from folks who have just taken very stressful, several stressful calls, right, in a row. I think you talked about it, but we often talk about the stress of police, but you all have stress, like the dispatchers, right? I've heard their stretch is a little bit even different because they don't actually know what happened at the end. And so trying to divert that. The other thing that I like that Mark 43 is working on is like processing the language to pick up on patterns, or to that question that we were talking about earlier about bad data. Again, this is something to be worked on, but it's worth being worked on. And actually, like what you all were saying about violence, like how do you define violence? You all know this. Like when you start out these programs, a lot of times your data is off because dispatchers don't want to give the calls to civilians because they're worried about something happening. And so you might have some ebbs and flows and some ups and downs in your data, and being able to talk about your program and show your program when you have humans who actually are not wanting to move forward. And so they are toying with the idea of, can the AI help you know what call it is, right? So you have a trespass or a disturbance or something, and that's coded in a certain way. But really, I think, like what you were saying, they're wielding a knife or whatever. So trying to help to process those calls and give the right response at the right time is something also that Mark 43 is looking at. So there's a role of AI, but I think we have to be super cautious. And I think maybe you even kind of alluded to this. We can't have it take the place of folks who have spent so much time on the ground. You all know your degrees and all that mean a lot, but really it's that other sixth sense of like, I kind of feel, and what's going on here, and so we want to make sure that stays a part of this work. That's why folks in this audience were interjected into this process in the first place, and we don't want to take that away.
Yeah, I'd love to learn more about the different use cases for AI and think about research in that area too. I've seen some AI in practice in a call center where it was sort of live doing transcription as a call taker was on a phone, and I was watching the language show up on the computer screen, and the caller clearly said the person does not have a weapon, and somehow the transcript said the person has a weapon. And I sat there and was like, oh my God, I'm freaking out. This is terrible. And I asked the call taker, I'm like, are you okay with that? And they're like, oh, it's fine. It's just in the background. It doesn't really affect me. But I could just see some situations where it could get really dicey really fast. So that definitely concerns me a bit. But thinking also around the prompt design piece, and so much of ChatGPT is like, how good is the prompt you put in? It's sort of similar to what call takers have to do. Like, how good is the question that you are asking the caller? I've been chatting with some conversation analysts, sort of, questions around, is the person threatening? That's like an objective fact you're asking for that's not centering the person who's experiencing the call in any way. It's not like, do you feel threatened? Which then Therese Todd, I was chatting with last night, raised the point, well, then that introduces all this bias that can come in because the caller is going to say, I feel unsafe. And I was like, wow, this is so hard to figure out what the right form of question is. But I am hopeful that there is a way to do this better. I think, Rob, you might want to jump in here.
Yeah, I mean, so AI, obviously, it's only as good as the training data you give it and the prompts you give it. If you haven't trained it on 911 calls sufficiently, it's not, 911 calls have a specific language to them, a specific way of, audio, all that sort of stuff. But you're never going to have a perfect transcript. The AI that I'm most interested in is not that's trying to substitute for the judgment of the 911 call taker or dispatcher, but is really sort of an additional tool. And you have to be careful on that, because if you have a tool that sort of suggests, well, I might, maybe this is the prompt, the inclination for the human is to just then default rely on that. And so that's not augmenting their ability, it's sort of taking the place of it. I'm most interested, aside from an AI tool that will handle the San Francisco procurement process, to get an AI tool, which I would really love. But the AI tools that I'm most interested in are sort of like the training the quality improvement, the data, and that can. I think that is one of the biggest gaps that we have as an industry in 911. The feedback, the training, the ability to QA a sufficient number of calls to ensure consistent quality. And if AI can really help with that, and I think there are some tools that really have promised to do that, then I think we can be better humans at doing the job that really the humans should be doing. So that's my interest.